So welcome to the sixth millennial goal. This is combating HIV, AIDS, malaria, and other diseases. And this is a map of Sudan. Welcome to the country. And this goal has actually been sub-split into several ways in which we can combat it. And the first is halting and reversing the spread of the disease, and then universal access to treatment for these diseases. Now, when it comes to HIV and AIDS, first Sudan is actually a fairly low infection rate for HIV and AIDS. Only about 0.67% of individuals in Sudan are infected with HIV and AIDS, and a lot of that is attributed to the Islamic belief, which many attribute to or ascribe to in Sudan. Roughly 97% are Islam, and Islam has a very strict rules against sexual promiscuity, which is actually the number one way in which the disease is spread in most countries, such as Ethiopia. But it is also spread through exposure to blood, which can be through needles or just open wounds, and then from mothers giving birth to a fetus, that can also transmit the disease to that child if the mother is infected. Now, unfortunately, one of the number one ways in combating the spread of the disease is first knowledge of how it is spread, and only about 4% of people in Sudan know how HIV and AIDS are spread, which are through those three main ways. And so the best way is through schools to teach how these diseases are spread. But there are actually several VCT centers, such as here in Kotoram, and many of these hospitals do teach how to prevent how these diseases are spread. But unfortunately, only about 25 to 30 people per hospital actually go to the hospital to be treated or to even see if they have the disease in the first place. And those treatments actually only go on for a limited time, because usually when a doctor is transferred or leaves, their patients will stop seeking treatment because they don't know any of the other doctors, and maybe due to a lack of trust or things like that will stop the treatment. And so in order to really drop the HIV AIDS rate any lower, there would be a need for those people to continue and for education of the disease. Now, the most rampant disease in Sudan is actually malaria, which is a parasite that's transmitted mostly by mosquitoes. It can also be transmitted through mothers giving birth to a fetus who might be infected, and then also through direct blood contact. And now, when it comes to malaria, the two hardest hit with this disease in Sudan are West Darfur and then the Blue Nile. We'll jump to the Blue Nile first in just a few seconds. But the Blue Nile is very close to a large body of water, and the body of water was created by a dam that was constructed in the area to regulate the amount of water that is transported through the Nile River, or at least this portion of the Nile, which is the Blue Nile. And being that there is a large body of water, it allows for many mosquitoes to reproduce, and because of it, there's actually a 12.5% rate of people in the area are infected with the disease. Now, malaria is a very nasty disease. It's a disease it's a parasite that actually will infect the liver usually first, and as it infects the liver, it multiplies very rapidly and can cause the liver to burst when it gets too full with the disease or with the parasite. And then as the parasite is allowed to leave the liver into the bloodstream, it will infect the blood cells and cause them to die, and it can eventually cause death in the individual. Now, like I was saying, here's the West Nile, or the Blue Nile, I apologize, the Blue Nile, and you can see the dam up there in the top where it kind of stops the water from flowing, which is why you have that large body of water, once again allowing for the production of many mosquitoes. Now, UNICEF has been helping as much as they possibly can and trying to provide households with insecticide treatment nets, but unfortunately there's only about a 41% of households having even one insecticide treatment net, and that rate needs to be much higher in order to really take malaria down, if at all, because the number one way to prevent it is by those nets. Now jumping over to West Darfur, as you can see, West Darfur has a very large tributary as well, which leads over to the White Nile, and because there are so many rivers in this area, this is also a big hotspot for malaria, being about 7.8% of individuals being infected with malaria. Now, going to our last infectious disease, being TB. Tuberculosis infects around 120 people per 100,000 people, so it's fairly low. But being that TB can be spread through the air, it's one that is very, very dangerous. And the detection rate of the disease is actually only about 46.2%, and it is so low because it can be kind of dormant for a while. It can usually the immune system is pretty good about warding off tuberculosis, but if the immune system gets too weak, it can spread very fast, and then it destroy the lungs, destroy organs, and cause a lot of issues, even death. And the best way to prevent it is early detection and early response. And that is the Millennium Goal 6, combating malaria and other diseases. Thank you for listening.